Welcome to this online lesson titled Surgery Without Pain and Infection. How did surgery improve in the 19th century? Our aims in this lesson are to know about the developments in anaesthetics and antiseptics, to explain the effects of these developments, and to evaluate the impact of these developments on surgery. Pause the video while you note down the title. If not, we'll proceed. Firstly, there are quite a few bits of specialist vocabulary that we need to know before we can proceed with this. So here are our key terms. Firstly, an anaesthetic, a chemical medicine usually injected or inhaled that prevents pain. General anaesthetic, an anaesthetic that puts the patient to sleep temporarily. Local anaesthetic, an anaesthetic that leaves a patient awake or only deadens pain in one area. Antiseptic surgery, when a surgeon prevents or kills infection by sterilising equipment. And aseptic surgery, surgery where germs aren't present at all. Okay then, record and describe each of these key terms, and then consider when might a local anaesthetic be better than a general one, and what is likely to be more effective, antiseptic surgery or aseptic surgery. Consider your answers and pause the video while you do so. Well, hopefully we've noted down the key terms. So a local anaesthetic can be very useful when you want the effects of the anaesthetic to be less severe. After all, recovery times from local anaesthetics are often better than general anaesthetics, and they carry less risks. Also, it allows the patient to provide you with some feedback sometimes while you're working. What is more likely to be effective, antiseptic or aseptic surgery? Well, I'll give you a bit of a clue. Aseptic surgery is what we use today. It is far better if we eliminate the germs being in the environment at all, rather than just trying to let them in and kill them once they're there. Let's consider surgery up to 1847. You may remember the way that surgery was done in medieval times. This was often with the barber's surgeon, and if you're unfamiliar with this, look back at one of my previous lessons on the people who helped the sick in medieval times to remind yourself. It was little different even well into the reign of Queen Victoria. You're about to review the procedure for an amputation in the early 19th century. It should seem very familiar to what you've already seen about surgery in the Renaissance and even in the Middle Ages. So let's have a look. This source is going to help demonstrate things to us. It appears to be a James Gilray cartoon or something of that similar sort of style. I'm not absolutely sure, but it's that sort of almost cartoonish and quite exaggerated style. Nevertheless, it's got some quite useful information for us and will help illustrate this particular procedure. So let's consider the tools of the trade. A saw, a sharp curved knife, cauterizing irons, a block of wood, some alcohol, rope, an apron, bandages, a mallet. Our tasks are going to be as follows then. Record these risks as headings: pain, infection, blood loss and shock. This can always be remembered as PIBS for short. Firstly, what measures are taken to manage these risks? Make notes under each heading. Which risks are not effectively addressed? How much does this represent change or continuity from the Renaissance? And how much does this represent change and continuity even from the Middle Ages? Alright, let's have a look at the process then. Stage 1. The patient was not an anaesthetist. They may have been hit over the head or given some alcohol, though not for amputations because that would thin the blood and make it more likely that they actually bleed out, or just given a wooden block or strap of leather to bite down on and told to hope for the best. Alright, here's our first stage. Make some notes under pain, infection, blood loss and shock. Hopefully you've recognised then that the main problem here is pain. There is virtually no deadening of the pain at all. And this can lead to shock, and that's worth remembering as well. Number 2. The surgeon would not take precautions to prevent infection. The cause of this remained unknown until germ theory in the 1860s. Again, make some notes under the headings pain, infection, blood loss and shock. Hopefully we've identified that there is a risk of infection here. Note how in the picture, as in real life, no one is actually taking any precautions to prevent germs, no one's wearing particularly clean clothes, and we can't guarantee that any of those tools have been sterilised either. After all, some of them are simply lying on the floor. Stage 3. Speed was key. The main causes of death were pain, infection, blood loss and shock. Speed helped with the pain and shock. Continue with your notes. Stage 4. The patient will be held down on a rope or cord tourniquet tied around the limb to be removed. This would help prevent it bleeding out entirely. Number 5, the surgeon would cut deep down to the bone in one swift movement using the curved knife. The flesh is pulled back to reveal the bone, and the surgeon quickly saws through the bone, removing the limb. The pullback flesh is stretched over the bone to form a stump. Blood would be pouring out over the surgeon's apron at this time, assuming he's wearing an apron. The wound would be cauterized by hot irons or ligatures. These ligatures would be used to tie off blood vessels and were a development in the Renaissance. These easily became infected though. The stump would be wrapped with bandages to soak up any remaining blood. Only then could the tourniquet be cautiously removed. The patient would be left to recover. Success was about 50-50, with infection from unwashed tools common, as was shock and loss of blood. Okay, if you need to re-watch any of that to take further notes, then now's your chance to do so. If not, pause the video here and make sure that you complete those tasks. So we should have got some good notes under pain, infection, blood loss and shock now. For pain, there is no anaesthetic, so this would still be a huge problem. In terms of infection, there are no preventative measures taken whatsoever. In fact, the dirtiness of the tools and the clothes and the general poor hygiene of the people around the person being operated on would make this an incredibly common and very risky part of the process. Blood loss was managed in some ways, with the cautery irons and with the ligatures. However, it was still a serious problem, and it was not unusual for patients to bleed out entirely. And shock? Well, the only real way of trying to deal with that was by doing it as quickly as possible and preventing as much blood loss as possible. This is why the survival rate was so poor. So which risks are not effectively addressed? Well, pain isn't addressed because of the lack of anaesthetics. Infections definitely isn't addressed. Blood loss and shock are perhaps partially addressed, but not necessarily effectively. So does this represent any change or continuity from the Renaissance? Well, it's almost entirely continuity. Does it represent much change or continuity from the Middle Ages? Well, although ligatures have been developed to tie off blood vessels by this point, this was pioneered by a French doctor called Paré, or a French surgeon I should say, actually not much else has changed since the Middle Ages. Effectively, the tools of the trade and the methods of hacking off someone's limb between the Middle Ages and between Queen Victoria's time were little different. And this is partly down to the fact that the understanding of what causes things like infection are also little different. But let's see how things change. What were the dangers of 19th century surgery? Well, let's remind ourselves. Make some notes. Firstly, pain. Then infection. Then blood loss. And then shock, or PIBS for short. Once you've noted down these headings just as a way of remembering it, then we'll move on. Let's consider the problem of pain. We're going to have a look at a source now. Novelist Fanny Burney's account of her operation in 1811. As a novelist, she writes in a very descriptive and graphic way, which hopefully you'll enjoy. When the dreadful steel was plunged into the chest, cutting through veins, arteries, flesh, nerves, I began a scream that lasted the whole time of the incision, so excruciating was the agony. When the wound was made and the instrument was withdrawn, the pain seemed undiminished, for the air that rushed into those delicate parts felt like a mass of sharp daggers that were tearing at the edge of the wound. Yikes. Alright, let's do an exam-style question based upon this. What can you infer from this source about the risks of surgery in the early 19th century? It's 4 marks. All you need to do is say what you can infer and give the detail in the source that gives you this clue. Remember, an inference is going beyond just the blindingly obvious that's in the source itself. It should be about what that can tell you about the risks of surgery. So be specific about that. You should spend about 6 minutes on this task at maximum, and you can pause the video now while you do that. Okay, let's have a look at an example answer. What can you infer from this source about the risks of surgery in the early 19th century? I can infer that patients had no anaesthetics to relieve the pain. The detail of the source that tells me this is that the author describes the pain as excruciating. I can infer that few if any precautions were taken to prevent infection. The detail of the source that tells me this is that the source describes the wound as being open to the air and does not refer to any equipment being sterilised. Okay, pause the video here and make any improvements and corrections necessary to your own work, bearing in mind that you may have made different inferences and used different examples from the sources, but as long as it follows this format and looks at the risks of surgery in the early 19th century, you can consider yourself to have done very well. A breakthrough. In the 1840s, a new anaesthetic was used, ether. This could make a patient unconscious, but if too much was used, it could kill a patient. It was also highly flammable. Take a moment to answer this quick question. Why might these facts make ether unsuitable as an anaesthetic, particularly in the 1840s? There might be some clues in the pictures. Pause the video now while you complete that task. Okay, well, aside from the obvious risk to the patient, although it should be pointed out that incorrect uses of virtually any anaesthetic can kill a patient, in particular in the 1840s, light was produced primarily from flames, whether from oil lamps, candles or whatever. So if you're needing good light to use your ether and to operate upon a patient, you're probably going to have some flames nearby, which is not an ideal mixture with a highly flammable liquid which also gives off a potent and flammable gas. So ether is a start, but it's not really going to do the job long term. A better way, therefore, had to be found. Luckily for medical history, it was. Why did things change? Like so many good ideas, it all started with a massive booze-up. I mean few ideas, obviously. Enter the scene Scotsman James Simpson. There he is. In 1847, Simpson and some friends had been, shall we say, experimenting with some different chemicals, inhaling them, to see what... Sorry about that, I don't actually know what happened there. I just sort of breathed in this gas and then everything sort of went blank and now I've got a headache. Okay, where are we going to? James Simpson, there we are. This is the discovery of chloroform. When Simpson and his friends woke up again during their experimentation, they had splitting headaches and a hangover that would slay a moose. However, Simpson realised that he'd found something quite significant here. The substance that he and his friends had inhaled was chloroform, and that chloroform had put them to sleep quickly, but temporarily, and they'd woken up essentially unharmed, aside from a few bumps on the head, which, funny enough, they couldn't feel either. So Simpson's discovery of chloroform. Simpson was a doctor who was specialised in the treatment of women and expectant mothers. Simpson was distressed by the numbers of women that he witnessed suffering and dying in childbirth. Simpson and his friends were experimenting to try and find an anaesthetic. They weren't just having a laugh, and I really should make that clear. They discovered chloroform by chance, but they were looking for such a chemical. Remember what Pasteur said about fortune favouring the prepared mind. Simpson published and shared his ideas once he had made them. Okay, let's complete these tasks then. Explain the role of each of these factors in the success of Simpson's discovery. Firstly, individual genius. How did Simpson's experiences and ideas help? Next, new technology. What new developments made it possible? And lastly, chance and luck. Was Simpson fortunate too? Then, which factor was most important in your view? Explain your choice. And lastly, write a brief summary of how Simpson discovered the effects of chloroform. Pause the video here and complete those tasks. Okay, hopefully we've recognised the role of individual genius here. Simpson not only recognised the importance of what he had discovered, but he was looking for it. And this was very much linked to his own experience as a doctor who worked with expectant mothers and was distressed to see how many of them were died. What about new technology? Well, the development of new chemicals like chloroform allowed Simpson to try out these new things. These are advancements in chemistry. But he was slightly fortunate as well. Although Simpson was looking for such a solution, there was no telling that he would find chloroform was effective, which he did. So which is most important? I'll leave that up to you. But hopefully we've got a summary that Simpson was a doctor who worked with women and expectant mothers who was trying to find a way of alleviating their suffering in childbirth. In order to do this, he experimented with a wide variety of different chemicals until he found one that worked, partly by chance, and that one was chloroform. He then published and shared his ideas so that the wider world would know. So if chloroform worked and it saved lives, surely it was supported right away. Well, not entirely, no. As we often find with medical advancements, there are people who are against them. What we're going to do now is we're going to see a variety of arguments both for and against chloroform, summarise each argument and explain what might have led to that person's different opinion. Then secondly, what would be the likely effect of this opposition on the use of chloroform? Opinion number 1. Anaesthetics are true lifesavers. They prevent a mother from feeling excessive and dangerous pain, which itself can cause panic and danger to both mother and baby. Also, should any difficulties occur in the birth, the anaesthetics can allow the midwife to deal with them in a calmer, more precise manner. And another view. Anaesthetics are sin. God made childbirth painful as a punishment for mankind after Adam and Eve ate the forbidden fruit in the Garden of Eden. If God had wanted childbirth to be pain-free, he would have made it so. For we humans to intervene in such matters is against the will of God Almighty. And lastly, no, sir, I do not agree, sir. It does strong, stout soldiers good to go through the agony of treatment, for it makes them stronger, more resilient men. Just look at me. I lost my arm to a cannonball. Best thing that ever happened to me. Huzzah! Okay, well, maybe some of those opinions are a little bit exaggerated, but they're there to give you the kind of overall effect and view of these different sections of society. And hopefully we can make a little bit of an inference as to what sort of person has said each one. Pause the video here, summarise each argument, and then complete the other task too. Okay, so the first argument is very much that anaesthetics are helpful to both mother and baby, and make childbirth, which was such a dangerous thing in the 1800s, a much safer activity. Then the next view is that this is somehow going against the will of God. If you've done some Bible studies, you might realise that in the Bible it basically says that the pain of childbirth is a woman's punishment for the original sin of eating the forbidden fruit. Regardless of whether you agree with that view or not is another matter, but actually it was quite a widely held view in the 19th century. And the last one is a soldier's view, or at the very least an officer's view. Okay, I've included a picture of a real soldier there. That's Lord Raglan, who genuinely did lose his arm to a cannonball, though I would have to point out that he didn't actually say those words. So what might explain their different point of view? Well, let's not forget that mothers are the ones who are taking the biggest risks here by having the babies. They're the ones feeling the pain, and so it only makes sense that those who are at most danger and are most likely to suffer through the pain of childbirth would actually be really in favour of it. The next person, you might be able to tell from the photograph, represents the view of the religious community, and particularly those more sort of traditional and conservative ministers of religion and vicars of the time. And then lastly, the view of soldiers, or rather their officers more particularly. I'm sure that the common soldiery were much more in favour of having anything that would reduce their pain. But it was genuinely believed that things like pain made a person stronger. We now understand that actually it can cause significant trauma and really affect a person for the rest of their lives. So these views are very outdated, but they were very much current at the time, and shows actually that the effect of this opposition would be it would make it hard for some doctors to recommend chloroform, and even harder for other people to request it or even accept it if it was offered. But science won the argument in the end. Queen Victoria was the first prominent person to use chloroform in childbirth. So, explain why this would overturn much of the earlier opposition to chloroform. Pause the video here while you consider that, and then I'll give you a few tips. Firstly, at this time, probably the biggest celebrity in the country was the Queen herself. So seeing her as a high-profile person using chloroform meant that other people were more likely to accept it as a medicine as well. But don't forget that actually the Queen of England is also the head of the Church of England. So if she used it, then clearly there can't be that many religious objections to it. And so many of the Church of England, at least, religious objections to the use of chloroform were completely overturned by Queen Victoria having used it. What was the significance of chloroform? Chloroform was the first effective and relatively safe anaesthetic. An anaesthetic deadens the pain of surgery. One that deadens pain throughout the body and puts the patient to sleep is known as a general anaesthetic. Before you go any further, pause the video here and just make some brief notes on that and make sure you've got it clear. Done? Alright, what's next? Explain why each of the following was less effective as a method of pain control than chloroform. Alcohol, a knock on the head, and simple mind over matter. Pause the video while you consider each. Well, firstly, alcohol was effective in some respects, but mostly ineffective. After all, it thinned the blood and increased the risk for the patient. Not only that, tremendous amounts of alcohol were necessary in order to actually have any sort of anaesthetic effect, and that in itself was incredibly dangerous. And so this was not a really effective method. What about a knock on the head? Well, that has huge dangers as well. Get it too hard, then you could kill the person, crack their skull, or, it could just not be effective at all anyway, and you've just done them more harm than good. So what about mind over matter? Mind over matter had been relied upon for many, many years. Bite down on this piece of leather and hope for the best. Of course, that's not really going to deaden the pain, but it might just show the person's bravery. Instead, a general anaesthetic like chloroform made things far safer, as long as it was properly used. Nitrous oxide, or laughing gas. This is another important anaesthetic, though it's not as crucial as chloroform. Laughing gas was first used medically in 1844, but didn't become popular until the 1860s. Here are its advantages. It's reasonably safe, and it has an analgesic effect. It's pain relieving. Patients remained awake and responsive, although pain is dulled. Here are its disadvantages. It's not a general anaesthetic. It's rarely used to put a patient to sleep. It can also have unwanted euphoric effects, a bit like a drug. That's why it's called laughing gas. It's also not as powerful as later anaesthetics like chloroform, and it didn't work on everyone. Firstly then, laughing gas is still widely used in dentistry. What about its advantages might help explain this. And laughing gas is not often used outside of dentistry. Why would a general anaesthetic like chloroform be superior? It would also be worth noting down some of the key facts about nitrous oxide, its pros and its cons. So pause the video while you do this. Okay, let's consider the pros and cons and why it's used in dentistry. It's actually quite useful for dentists to have a patient who's still responsive. It can make sure that their mouth is still open, they're still breathing fairly normally, and they can provide some feedback while the dentist is examining the teeth. However, it's not often used outside of that, because actually most of the time there are better anaesthetics for completely deadening people's pain, and also ones that don't have so many of the negative effects that laughing gas has got. So did anaesthetics solve everything? Remind yourself of the problems of surgery: pain, infection, blood loss and shock. Which have been solved or at least helped by anaesthetics? Which have not, and why? Pause the video here and consider your answers. Well, let's take them one by one. Pain has largely been solved by anaesthetics, as long as they are used correctly and as long as they don't do any extra harm to the patient. What about infection? Well, probably not really. Later on, of course, anaesthetics would allow doctors to take or surgeons rather, to take a more considered approach when they were doing things, and that could help prevent infection, but in the early sense, not really. Blood loss? Well, it's probably helped a little bit there as well. Again, surgeons being able to take their time means that they're less likely to do any other collateral damage to the body, and that allows them to be a little bit more calm and deliberate with the way that they patch the patient up afterwards. And that certainly helps with shock as well. Because the patient is likely to lose less blood, and because the patient is likely to be in less pain, they're less likely to suffer the effects of shock. So we should really recognise here that blood loss has not been entirely solved, although it certainly has gone a long way towards it. But the big one that's still not been solved is infection. Let's see how that changes. Making surgery cleaner: Lister and antiseptic surgery. The problem of infection: Joseph Lister. Our next important figure in the history of surgery was Joseph Lister. Lister found a way of helping prevent infections. It was rather unpleasant for the surgeons, but it did save lives. He used something called the carbolic spray during operations to prevent infections. Let's see what that involved. Let's consider the pros and cons of carbolic spray as a technique. You can see it being used in the picture there. Notice that none of the surgeons are actually wearing face masks, they're not wearing any protective equipment or antiseptic equipment, but what they have done is they've sterilised and cleaned all the tools. So if you look at the knife that Lister is using there, he's got a little tray next to some pots of carbolic acid where the tools have all been dipped and cleaned before the operation. Most significantly though, it's about preventing the airborne infections getting into the open wounds. So you can see that one of the assistants is using a hand pump to spray the air above the wound with carbolic spray. This was reasonably effective, but it wasn't entirely popular. Some key facts then. Firstly, Lister's ideas were not immediately adopted or widely used, partly because of the significant disadvantages of the carbolic spray. It killed bacteria, which caused infections though. It was also used to wash equipment and the surgeon's hands. But it does sting when it's breathed in. It made surgeons' hands sore and cracked the skin too. You can notice that nobody's wearing any gloves in that picture. It was first used in 1867 and was partly inspired by Pasteur's germ theory. After all, Lister was deliberately seeking to kill the germs that Pasteur had discovered. So our task then, arrange these above points in the correct categories between pros and advantages and cons and disadvantages. We'll go through some potential answers once you're done, so pause the video while you complete that task. So, the fact that Lister's ideas were not immediately believed and adopted is a definite con to this, and made it very ineffective as a technique because people simply didn't use it. However, what was useful is it genuinely did kill bacteria and help prevent infections, which was useful when they were washing equipment and the surgeon's hands. But it did sting when it was breathed in, which was again something that made it unpopular, and it could also affect the patient's recovery. It made the surgeon's hands sore and crack the skin, which made surgeons again less likely to use it, but could also affect their dexterity if they had a lot of operations to perform. But a definite pro is that it was based upon a proven theory, Pasteur's germ theory. This made it more credible and also shows that people are better understanding the risks of surgery. Make any corrections that you need to do. Let's consider how Lister made his discovery. Firstly, what did Lister discover? Even after successful operations, patients still died as their wounds became infected. Lister set out to solve this problem, and in some ways he did. His short-term importance. Longer and more complicated operations became possible as the danger of infection was reduced. How about his long-term importance? Other doctors built on his ideas. Hospitals and operating theatres became cleaner. All the equipment and the room was sterile. Or at the very least, that's where it led to. Lister was not about sterilising the entire room and preventing any germs getting in. That's aseptic surgery rather than antiseptic surgery, which is what he did. But by making his breakthrough, Lister starts the process which eventually ends up with modern aseptic surgery. Now his background. His father developed better microscopes. Think about what access this would have given Lister. How about the impact? More of his patients actually survived their operations. The percentage of his patients who died after operations fell from 46% to 15%. More about his background. He became a surgeon in Glasgow and later in London. His ideas spread and were used by other doctors, although many doctors and surgeons had at first been reluctant to believe in his ideas. He also did research into infected wounds. In 1867, Lister read Pasteur's work on bacteria. He thought that bacteria may be causing the infections, and he used carbolic spray to kill the bacteria. So this is antiseptic surgery, killing the bacteria rather than trying to prevent it entirely. Follow-up task number 1. How did Lister's background and training help him? Number 2. What was Lister's great discovery? Number 3. How was Lister helped by the work of other people like Pasteur? Number 4. What effects did Lister's work have in the long term? Explain what you think using any fact or statistics that you can draw from this source. Pause the video here while you complete those tasks. Alright, so his background and training helped him in several ways. First of all, access to quality microscopes would have allowed Lister to study bacteria. Not only that, but his work in both Glasgow and London meant that he was able to meet a greater variety of people, and this helped his ideas to spread and actually probably helped him to formulate his ideas as well. And also, his background as a scientist and the scientific background within his family probably helped him to do his research and to take a more scientific approach. Because his great discovery was really that the bacteria caused the infections within operations, and that something like the carbolic spray could fight that. So he was inspired by the work of other people, particularly Pasteur, By reading up on Pasteur's germ theory and then supposing that the bacteria that Pasteur claimed made things go bad was also causing the infections within operations, helped Lister to produce a more effective medicine in the sense of the carbolic acid. So in the long term, this had several effects. Although it wasn't adopted very much early on, it does eventually lead to antiseptic surgery and later aseptic surgery as described, and you can support this with a statistic. Having his victims dying from operations falling from 46%, or almost half in other words, to 15% is actually a massive reduction. This shows that his new techniques were very effective. Pause the video while you make any improvements that you need to, and then we'll move on. We're now going to see another demonstration of an operation, but this time late 19th century surgery. Change or continuity. We're going to do a similar activity, the one that we did earlier with the early 19th century surgery, but with a few key differences. This time the tools of the trade are bladed tools for cutting and sawing. These are not especially different to what we looked at earlier. Carbolic acid to sterilise tools. Carbolic spray to sterilise the air in the wound. Sterile stitches and chloroform. Your first task then, record these risks as headings: pain, infection, blood loss and shock. As we go through the demonstration, note down what measures are taken to manage these risks by the late 19th century. So make notes underneath each heading. Alright, let's go on with the demonstration now. You can pause the video after I've read each one and make the notes as you need to. Stage 1. The patient is anaesthetised with chloroform. An anaesthetist stays close to increase the dose as necessary. Notice that the anaesthetist is holding a mask in one hand and a bottle presumably containing chloroform in the other. Such masks are very effective. It contained a gauze over the patient's face, which could be soaked in more chloroform if needed, so if the anaesthetist saw that the person was coming round, they could always increase the dose of chloroform if it was safe to do so. Stage number 2. Specialist tools were sterilised with carbolic acid before the operation. Stage number 3. The surgeon himself was more qualified and professional, but did not yet wear specialised clothes or sterilised clothes. Stage number 4. The carbolic spray was used to sterilise the air over the wound and the hands of the surgeon. Here we can see another activity that is designed around antiseptic surgery or killing the bacteria. Stage number 5. The anaesthetised patient no longer needs to be held down. The surgeon can work more carefully and slowly and also perform deeper and more ambitious procedures. And lastly, number 6. The wound can be carefully stitched up with sterilised stitches. The risk of pain, infection, blood loss and shock are greatly reduced. Okay, complete your notes for task 1. Press pause, and then when you're ready to continue, press play again. Let's follow up with a couple other activities. You can see these at the top. Number 2. Which risks are still not effectively addressed? And how much does this represent change or continuity compared to earlier surgical techniques? Compare it to the earlier version and the work that you did there if necessary. Pause the video while you complete those tasks, and when you're ready, press play. Well, most things are effectively addressed, but there are some problems. For example, the disadvantages with the carbolic spray really need to be overcome for more ambitious operations to be conducted, but also to increase the number of surgeons who are taking it up. But also, infection isn't entirely reduced. For example, the lack of face masks and the lack of specialised clothing remains a serious infection risk, and that's not been solved yet. But this does represent a huge amount of change compared to the earlier techniques used. Although the tools of the trade are quite similar in terms of how you actually cut the patient up, and again we're only demonstrating an amputation here, virtually everything else is different. The use of the anaesthetics, the use of the antiseptics, the use of sterile stitches, and of course the much better chances that the patient would have. Pain has been reduced, infection has been reduced, blood loss has been reduced, and shock has been reduced. It's no wonder that Lister's patients went from having a 54% survival rate to an 85% survival rate. So finally, how were the problems of surgery solved? Note down these headings or as the centre of small mind maps. Your final tasks then. Add the specific solutions to each problem to the headings. Some may go with more than one, you can link them together. And in your view, were all of the challenges of surgery overcome in the 19th century? If yes, how? If not, what still needs solving? Once you've done this summary, that's the end of the lesson. I'll say thank you very much for watching. I hope it's been useful and interesting. And if it has, give this video a like and subscribe to the channel for even more GCSE content. Thanks for watching and goodbye.